Assalamualaikum, I am Ayafamisi Makalindao and I will discuss the pertussis, which is also known as the whooping cough, because a person suffering from pertussis tend to produce a whooping sound when they try to gasp for air after a coughing fit. So there are 20 to 40 million cases before the introduction of the vaccine and 400,000 fatal cases, and way back 1914 is the introduction of the vaccination. The first isolation of the bacterium is from Jules Bordet-on's son, Paul, after 6 years of discovery together with Octave Bengu. So this pertussis is a localized infection of the ciliated epithelium of the bronchial tree, and the pathogen produces toxins which cause local damage to the cilia of the epithelial cells. So these extracellular toxins are pertussis toxin, invasive adenylate cyclase, and also the tracheal cytotoxin. So whooping cough can cause rapid, violent, and uncontrolled coughing fits until all air is gone from the lungs. So these coughing fits can go on up for up to 10 weeks or more. So this is what whooping sounds like.
It's just kind of heavy. Uh-oh. There we go.
So that is the whooping sound na napoproduce ng patient pag nagagasp sila ng air after a coughing fit. So this is a coughing fit. That is the coughing fit.
Okay. It's okay. Okay, take a breath, honey.
And that is the whooping sound. So the disease affects mainly children, but adults have also been increasingly reported to be affected, and the first outbreak of pertussis was once described by Guillaume de Bellu on 16th century. For the causative agent, we have the Bordetella pertussis, or small gram-negative encapsulated non-motile coccobacilli with outer pili. So some studies reported that the bacteria are covered with biofilm or the surface slime, which is composed of carbohydrates. So this bacterium is very fastidious in its nutritional requirements because it needs nicotinamide supplement, and its growth can be inhabited by the presence of fatty acids, metal ions, sulfides, and peroxides. So it is a strict aerobe and grows optimally at 35 degrees Celsius to 37 degrees Celsius. So it produces toxins which cause local damage to the cilia of the epithelial cells, which leads to prolonged illness and pertussis. So I have already mentioned those toxins. Chain of infection. So the causative agent is alkaligenaceae for the family, and its genus is Bordetella, and the species is Bordetella pertussis. So the only reservoir is human, and the portal of exit is respiratory secretions. The mode of transmission is direct contact with secretions from respiratory tract of infectious person. So the bacterium survives for 3 to 5 days on inanimate dry surfaces, but 5 days on clothes, 2 days on paper, and 6 days on glass. So it is highly contagious, 80 to 90% to susceptible host. So the portal of entry is nose, mouth, and eyes, and the susceptible host, or the people who are at risk, are pregnant women, infants, elderly, and those immunocompromised people. Of infection, we have here the catarrhal stage, the stage 2 paroxysmal stage, and also the convalescent stage or the recovery stage. So the incubation period of this disease is 7 to 10 days with a range of 4 to 21 days. For the signs and symptoms, the stage 1 is also is the catarrhal stage. It can last for 1 to 2 weeks. And then these symptoms are runny or stuffed up nose, rhinorrhea, sneezing, low-grade fever, mild and mild occasional cough. So we have here the stage 2, paroxysmal stage, 1 to 2 weeks after the first symptom starts. So paroxysms, which is a rapid, violent, and uncontrolled coughing fits, it will last 1 to 6 weeks, but can last for up to 10 weeks. So coughing fits generally get worse and become more common as the illness continues. Vomiting during or after the coughing fits, feel very tired after the fit, but usually seem well in between fits, and then they struggle to breathe. Babies may experience severe cough, choking, poor feeding, and apnea without paroxysmal cough. So for the stage 3, convalescent stage, respiratory symptoms gradually decrease, although coughing may last for several months. Now let's proceed to the pathophysiology. So for the pathophysiology, we have here those people who are at risk. We have here the pregnant women, the immunocompromised people, infants, and those elderly. And then this Bordetella pertussis will be inhaled. So microscopic droplets carrying Bordetella pertussis are inhaled. So that is the mode of transmission here in this process. We have after the bacteria will be inhaled, the bacteria will hook to cells lining the throat, whose hair-like cilia sweep away from foreign objects, and then it will then will stay there in the epithelial cells, and this bacteria will release a toxin that paralyzes the cilia and kills the cells. And then this toxin released in the lungs spreads throughout the body, and then it will then lead to complications, which one of the complication, which is the pneumonia, if the tiny air sacs, which is deep in the lungs, become infected. So other complications are bronchopneumonia, umbilical hernia, and fracture of the ribs from severe coughing. So for the medical management, we have here the assessment and diagnostic test, history taking to check for details of exposure, medical history, and any allergy to antibiotics so that we can prevent drug interactions, and then physical examination, which most of the doctors rely on the characteristic whooping sound and cough to come up with the initial diagnosis of pertussis. And then we have also the sputum culture, chest x-ray, to check for any inflammation or collapse in the lungs. For the pharmacological management, we have here the erythromycin inhibits the bacterial growth, prevent interpersonal transfer because of enhanced absorption, particularly in young infants, effective in reducing course and symptoms of pertussis. We have here the dosage, 50 milligrams per kilogram, PO, QID for 14 days. And then we have here clarithromycin, and then azithromycin, and also the trimethoprim sulfamethoxazole as an alternative to macrolide. So we have here the dependent interventions. Of course, as a nurse, we need to always check for vital signs, and then keeping breathing passages clear. This may require suctioning of mucus as ordered by the physician, providing oxygen therapy if needed, preventing or treating dehydration by administration of intravenous fluids as indicated, and then administer medications as prescribed by the doctor. And then for the independent interventions, we need to position patient in a semi-Fowler's position for them to breathe easily, and then monitor respiratory status, keep surroundings of patient free from irritants that can trigger coughing, instruct patient to eat small meals to prevent vomiting, instruct patient to get plenty of fluids like water, soups, fruits to prevent dehydration, and then report signs of dehydration to the doctor immediately. For the nursing diagnosis, ineffective airway clearance related to nasal congestion and excessive mucus production as evidenced by whooping cough, thick mucus, shortness of breath, and low level of oxygen saturation secondary to pertussis. Ineffective breathing pattern related to nasal congestion and thick mucus secretions as evidenced by shortness of breath, low level of oxygen level, and persistent whooping cough secondary to pertussis. Activity intolerance related to difficulty of breathing as evidenced by fatigue, overwhelming lack of energy, generalized weakness, shortness of breath upon exertion secondary to pertussis. Now for the prevention, we have the good hygiene. We need to always wash our hands to prevent the spread of microorganisms and for us to not acquire diseases. Then we have here the post-exposure antimicrobial prophylaxis, and then the vaccination, the DPT vaccination or the pentavalent vaccination. 3 doses are given and 2 booster doses, 16 to 24 months, and then the other booster dose will be given 5 to 6 years of age. So these 3 doses will be given 6, 10 to 12 weeks during the infancy. And then so for the elderlies, they can be vaccinated anytime. And that is all for my report. I hope you learned something and keep safe, everyone.